Anesthesiologists are responsible for providing pain relief to patients and monitoring patients' vital signs during surgery. Anesthesiology is a prestigious and lucrative field of medicine that requires a great deal of education and expertise. Begin preparing for your career as early as possible. Ideally, you'll do pre-med courses in college. But even if you graduate with a liberal arts degree, you can still attend medical school and become a board-certified anesthesiologist. So, we are going to watch about the how to become an anesthesiologist.
Method 1. Preparing for med school. First is get your high school diploma or equivalent.
You'll need to do one of these things to get into college or university. Take high school courses in biology, chemistry, and physics to prepare for a pre-med major in college. Challenge yourself by taking hard courses and getting good grades to impress both college and medical school admissions officers. Enroll in AP Science courses if you live in the US or Canada, or GCSE or A-level courses in the UK. Step 2. Attend a high school summer medical program if you can. Look for these programs through universities, like Georgetown or the University of Texas, Austin. You can also find them at some hospitals that have research facilities. Find a program that includes hands-on lab training so you can experience the actual work that doctors do. Attend a program that focuses on research if you want to pursue your own research project. While these aren't required, they are very educational and can do a lot to show that you are a serious and passionate candidate when you apply to college.
Step 3. Volunteer at a hospital.
Get to know the field by volunteering at a hospital or medical clinic while you're in high school or college. Talk to the doctors and medical school students you meet about preparing for a career in medicine. Continue volunteering as long as you can through high school and college to impress medical school admissions officers with your commitment.
Step 4. Take college entrance exams.
Choose whichever test is preferred at the colleges you want to apply to. Prepare for the tests using official study materials if you can acquire them. For example, in the US, get official SAT prep materials from the college board. Consider taking an exam prep course to improve your score. Retake the test to improve your score if necessary. This may only be an option with some exams. Step 5. Complete a bachelor's degree in pre-med or a related field. If you live in a country like the US where medicine is a post-baccalaureate degree, you'll need to complete college before pursuing a medical degree. Look for pre-health or dedicated pre-med programs at the college or university you attend. Take courses in organic and inorganic chemistry, biology, biochemistry, physics. Make sure your science courses all have a lab component. Consider doing classes in public health, ethics, and statistics. Consult your advisor about actual requirements for graduation.
Finally, prepare for medical school entrance exams.
Take exam prep courses. Set aside dedicated time to study for the exams during the academic year and in the summer. Do practice exams and read about any changes to the test so you are best prepared for the questions. For example, in the US, you'll take the MCAT. In the UK, you'll take the BMAT, GAMSAT, UKCAT, or HPAT, depending on the university where you plan to enroll. Find MCAT practice materials on Khan Academy, through the Association of American Medical Colleges, and in official MCAT publications. These include a guidebook, sample tests, and flashcards.
Method 2. Going to med school. First is find a medical school.
Look for accredited programs that offer the Doctor of Medicine, MD, degree or a Doctor of Osteopathic Medicine, DO, degree. Choose either path to become a fully credentialed physician qualified to become an anesthesiologist. Pick your school based on criteria that are important to you, like geographical location, student body and faculty diversity, financing, and matriculation data. For example, you might want to find a program that graduates the majority of students within 4 years. Step 2. Consider enrolling in a BA, BS and MD program if you live in the US. Look for universities that offer programs that combine undergraduate study with medical school. Find an accelerated program that will reduce your overall time in college and med school, like the program at Howard University. Be prepared for required summer school if you attend an accelerated program. Prepare for these programs by excelling on your ACT or SAT exams. Getting very good grades in high school. Demonstrating a commitment to a career in medicine. Like through volunteer work. Many programs are very exclusive and only accept a handful of applicants each year. Finally, learn the fundamentals of medicine in your first 2 years. Take courses like physiology, pathology, microbiology, and neuroscience. These courses will have a lab component. Continue taking courses in your second 2 years. And also gain hands-on training through rotations in hospitals and clinics.
Method 3. Specializing in anesthesiology. First is complete a 4-year anesthesiology residency.
This is necessary if you live in Canada or the US, or wish to practice in Canada or the US. Receive clinical training working in hospitals during your residency. You'll also provide supervised medical care to patients. Find your residency through the National Residency Matching Program, NRMP, which matches medical school graduates with residency programs. Supplement your education by completing an additional 1-year fellowship after your 4-year residency. Focus on a specialized field like cardiac or pediatric anesthesiology. Step 2. Find out the requirements for licensing or certification in your country. Demonstrate you are fit to practice medicine and prescribe medications through licensure or certification. Determine if this is through a national entity, or if it depends on the state or province where you live. Also look into any required exams. In the UK and other Commonwealth countries, you'll need to be registered. Obtain registration through the General Medical Council. Pass the United States Medical Licensing Examination, USMLE, and or the Comprehensive Osteopathic Medical Licensing Examination, COMLEX, 2 as part of the licensing process in the US. Apply for licensing in the state where you wish to work. Take the Medical Council of Canada Qualifying Examination, MCCQE, Part 1 and Part 2 and receive the licentiate of the Medical Council of Canada, LMCC, before applying for your license in the province where you plan to work. Step 3. Contact your licensing board in the US or Canada. Ask for complete information about the process so you can provide all needed information as soon as you apply. Compile a CV or other list showing all aspects of your training in anesthesiology, including information about your medical school studies, licensing exam results, your residency, and any fellowships. Follow up in person with the licensing board, especially offering to connect them with your medical school or residency program to speed up the process.
Step 4. Become board certified.
If you wish to practice in the US, this is recommended but not required. Demonstrate your expertise in anesthesiology and commitment to the field through certification. Take the required board certification exam offered by the American Board of Anesthesiology, ABA, or the American Osteopathic Board of Anesthesiology, AOBA. Both offer board certification exams. Prepare for the exams by going to the ABA or AOBA websites and searching for the links to the Pearson VUE exam tutorials and practice tests.
Finally, find work as an anesthesiologist.
Look for employment in hospitals, outpatient surgical centers, private and group practices, urgent care centers, or academic medical centers. You can also become a medical officer in the military. Be prepared to work long and irregular hours, sometimes over 60 hours a week. With ever-growing populations, there will continue to be an increased demand for anesthesiologists and other medical professionals.
We hope it is useful to you. Please subscribe to our channel to upskill yourself.